Hi, my takeaways from the Forbes mini doc are medical tourism is driven by a mix of cost savings, shorter wait times, and specialties access that isn't available or isn't affordable wherever that patient resides, such as in a state to state or country to country situation. Cities are actually actively branding themselves as medical tourism hubs to be able to lure patients in, whether that be for shorter wait times, a doctor's specific specialty. Um, yeah, the industry is becoming more formalized with their accreditations and everything, but there's still questions on things such as who's going to be in charge of the follow-up care. Does that doctor have somebody where that patient resides? Are they going to do a telehealth visit, or are they going to have to travel back and forth during that post-op period? Um, Infection and control rates are still in question. What does that infection rate look like in that home country? What is the infection rates if that person's traveling from country to country or even cross country, say like California to Florida even? And if that patient was to have complications back wherever their home is, whether it's a different country, a different state, who's responsible for complications if complications were to arise? For my specific place, I chose India. A lot of people travel there to have a CABG or a coronary artery bypass graft because the cost is much lower than Western countries and the US. And there are facilities actually accredited and have a high quantity of heart operations that lure the patient in for that surgeon's expertise. The mortality rate for these CABGs is in India is 6.6. I didn't find anything else on that. It varies obviously by patient's age, race, ethnicity, comorbidities, and what is actually happening with that patient as well. Some of the places in India actually cover lodging, transportation, like to and from facilities. And possibly from state to India. I didn't really find that. If they need a visa, they can cover the visas, and follow-ups are given via telehealth care. The estimated medical tourism market is in India is roughly 8.7 billion USD and is expected to rise in the next 3 years. My personal experience with medical healthcare tourism is me having to travel to, say, Sioux Falls to see all my providers because due to insurance, all of them would be in one area rather than where I live. I would have to go this direction for one healthcare or this, and there's only one provider where I actually reside. I also have experience where I've had family members that have to move from state to state because the child's healthcare for their chronic illnesses are better in this state than this, and then it changes every couple of years. Or from patients being seen in the VA even, they have to travel. In Arkansas, as an example, if they live in a rural area, they have to travel from this place to Hot Springs to Little Rock to Fayetteville, where can be anywhere from a 1 to 4 hour drive from state to state. I think medical tourism could be an issue due to all of the unknowns and what it brings to the patient, and that the US, specifically speaking, should be better about their healthcare cost and their insurance coverages and just generally caring for the people.